This is the ninth and final part in our series on evaluating morality. We have looked at evaluating morality from the perspective of the 7 deadly sins and the 10 commandments, and today I want to finish this series by addressing what I generally describe as difficult moral questions, because sometimes morality isn't so black and white. Sometimes we aim to do good things that have certain less than desirable side effects. If you recall back in our series on the natural law months ago at this point, I addressed the idea of object, intention, and circumstance. And this is going to be key to our discussion today, so we need to do a little bit of a review. Back then I explained that every human act, so meaning a moral decision, not just like, sitting down or opening a can of tuna fish. I mean, those aren't moral choices. Every human act, moral act, can be evaluated from 3 distinct perspectives. First, the object, which is the action that is chosen. For example, shooting an innocent person is morally bad, but shooting in self-defense is not necessarily. Of the 3 elements of the moral act, the object is the most important because it's what you're doing. It determines the objective morality of the action. A bad act, a bad object, can never be justified even with the best intentions or the craziest of circumstances forever. Or for example, there's never a good enough reason or a situation where you can intentionally take an innocent life. Second, we evaluate intention or motive, the person's purpose or desire. You can, tackle the president of the United States to the ground, either on one hand to become infamous, or you can tackle him to the ground to, protect him from a sniper's bullet. There's a difference, morally speaking. One of the more popular mistaken notions of morality is that if your goal is good, then however you choose to get there is okay. But that isn't objective reality. Anybody can make up a motive for anything in that case. And that's why in a system of morality that's based on the natural law, we have to look at the action first. The what, not the why. The end does not justify the means. The motive does not justify the object. And then third, we evaluate the action based on the circumstances, the surrounding conditions which might affect the morality of the action, whom, to whom, when, where, and how. And these can all change the seriousness of the action. When you mow your lawn at 2 a.m. versus 2 p.m., it makes a difference. To whom is it being done? Your mother, a priest, your sibling? It all makes a difference. Circumstances can make a good action bad. They can make a good action better. They can make a bad action worse. And they can make a bad action not as bad, but circumstances can never make a bad action good. Every intrinsically evil action will stay evil regardless of the circumstances. And with that in mind, the object, the intention, and the circumstances all need to be evaluated in that order to determine whether an act is morally acceptable or unacceptable. First, the morality of the action itself has to be judged. Second, the intention or the motive has to be judged. And then third, the circumstances. For an act to be good, the act itself, the intention, and the circumstances all have to be good. And any one of these 3 aspects, they can make an action immoral, but for the action to be moral, it has to have all 3 moral. If all 3 check out, then the action is morally good. If any part of it is bad, then that makes the action morally evil. The question then becomes, after we've determined if it's morally good or wrong, the question then becomes, well, how bad is it? And is that person morally responsible? Which sounds like splitting hairs, but there is a difference between deeming an action to be bad and being a person to be in the wrong. So back to my original question. How do we navigate difficult moral questions? Is it moral for someone starving to steal from the rich? Is it moral to lie to make someone feel better? Is it moral to destroy human embryos for research that could possibly heal millions? Is it moral to drop the atomic bomb on Japan at the cost of 300,000 lives versus 1 million lives of an invasion? Is it moral to jump on a live grenade to save my platoon? Is it moral to cut the rope because a fallen rock climber is pulling us all down? Is it moral to turn to doctor-assisted suicide to avoid pain and disease? Is it moral to supply drug addicts with clean needles versus dirty ones? Is it moral to do racial profiling to stop terror attacks? Is it moral to shoot someone in self-defense? Is it moral to abort a child to save the life of a mother? Is it moral to surgically remove a cancerous uterus of a woman when she's pregnant? These are all difficult moral questions, and there are ways of addressing them. The first thing we have to ask ourselves is, are we simply misunderstanding what actually isn't a moral difficulty at all? If you remember last week, I talked about how lying to Nazis about the Jews hiding in your house isn't actually lying to them because they don't deserve the truth. They aren't legitimate authorities. So sometimes what might on the outside seem to be a moral question actually isn't a question at all. And so we have to start there. But not every action has only good effects or bad effects. Sometimes there are bad results, even though the act itself and our intention and the circumstances are all good. Sometimes a bad side effect can't be avoided. What do we do then? Can you still take action? Cutting off someone's foot is bad, but what if you do it to save your life from severe diabetes? Is that ethical? It is if your direct action and intention is to save your life with no other good option. The loss of the foot is no longer the main action, the object of the moral choice. It's a side effect to losing the foot. It's a side effect to saving your life. You're not directly choosing the lost foot. It's not an end or a means. You aren't cutting off the foot because you hate the foot or that you want to get put on disability or collect welfare. The loss of the foot is a side effect of the necessary operation. Some situations involve doing a good thing for good reasons that has an undesired bad side effect. I choose to do something good to get something good, but the action also might have a bad side effect. In these sorts of situations with multiple side effects falls under something that we call the principle of double effect, which makes sense. It's something that we do that has two effects, one good and one bad, or it could be multiple of each. The principle of double effect can be used in many difficult moral situations. The classic scenario is the so-called trolley problem. This is kind of a classic, philosophy question when you're, philosophy 101 in college. But the trolley problem is that there's an out-of-control trolley full of people careening down a hill, and you have a choice. You can pull a lever that gets the trolley to safety, but there's an innocent bystander crossing the track at that exact moment. Do you pull the lever, instantly killing the pedestrian, or do you not pull the lever at the risk of the lives of everybody else on board the trolley? If you want to know the short answer, morally speaking, you can choose either one. But these hypothetical scenarios, I think, are pretty ridiculous. And in 16 years of being a priest, I've never had anyone ask a question as extreme as the trolley problem. So, however, the principle of double effect comes into play all the time when it comes to medical decisions. And so that's what I kind of want to talk about today. I've spoken in the past about medical ethics, saying that sort of in the mindset of end-of-life issues, nobody's required to go to extreme lengths, medically speaking, to preserve life. So, for example, you wouldn't give chemotherapy to a 95-year-old if they didn't want it, because that's an extraordinary means of preserving life. Double effect, similarly, it's going to be a little difficult to explain without like a whiteboard or something like that, so I can draw it out for you. So you might want to go back and listen to this again, or wait until this volume of my book is out, which, yes, I'm still working on it. Volume 4 is taking forever to edit. But with that said, I don't expect you to remember all the nuances of the principle of double effect from this one homily. I just want you to know that it exists, and that if you have questions, moral questions that might fall into this category, you can ask a priest about it and he can walk you through it. So the principle of double effect is permissible under 4 conditions, and all 4 have to be met. So the number 1 condition is the action chosen must be morally good, or at least morally neutral. You must be dealing with a good action or an indifferent action, remembering that it's never okay to perform a bad act in order to get a good outcome or a good result. The classic example is the quote-unquote abortion to save the mother's life. Is it justified under double effect? And the answer is no, because the action consists of the direct killing of an innocent person. Abortion as a procedure has no other intended outcome than the killing of an unborn person. That's the only thing abortion is ever used for. Abortion as a procedure, there's other medical procedures that might endanger the life of an unborn child, or in fact, as a side effect, result in the death of that unborn child, but they don't have the death of that child as their primary purpose, as the main goal. Death is not a side effect of abortion. By the very nature of the procedure, death is the entire point of abortion. For example, in what is called an ectopic pregnancy, and this is what most people mean when they say abortion for the life of the mother. An ectopic pregnancy is when the embryo, rather than implanting into the uterus, it implants somewhere else, most commonly in the fallopian tube. And if you are familiar with human anatomy, that's a bad thing. That poses an immediate risk to the life of the mother. And so when proponents of the abortion industry talk about, quote unquote, saving the life of the mother, a lot of times they're referring to the procedure of an ectopic pregnancy. And this is simply to remove part of or the entire fallopian tube, save the life of the mother, but that results in the death of the embryo. What they're not telling you is that they're purposely being deceitful by conflating the 2 procedures. Removing an ectopic pregnancy and abortion are completely different things. They're not at all related. Removing a fallopian tube is an entirely different thing than an abortion, which is the intentional killing and dismembering, often, of an unborn baby. With the ectopic pregnancy, the action is to remove the fallopian tube, not to kill the baby. With abortion, the whole thing, the whole idea, the whole procedure is around killing the unborn baby. So that's part number 1 of the principle of double effect. The action chosen must be morally good in itself, or at least morally neutral. The number 2 part of the principle of double effect is the good effect must not come about as a result of the evil effect, but rather must come directly from the action itself. In other words, the good action must cause the good effect, and not vice versa. The bad effect causes the good action. The evil effect cannot cause the good effect. Once again, this is simply saying that the end does not justify the means, and evil action isn't justified even if it results in a good outcome. Going back to our ectopic pregnancy example, in this case, the good action, removing the fallopian tube that poses a risk to the mother, causes the good effect. It saves the life of the mother. The evil effect, which is the unavoidable death of the unborn baby, doesn't cause the good effect. Baby dying doesn't save the life of the mother. It's an undesired side effect. So that's number 2. The good effect must not come about as a result of the evil effect, but must come directly from the action itself. The number three element of the principle of double effect is the good must be willed and the evil effect merely tolerated. So In this case, you are only intending the good effect, though the bad effect is foreseen and likely. It's not what you want. Rather, it's only permitted or tolerated. In these cases, you don't directly wish evil, but it may be allowed when it cannot be avoided or separated from the good effect. For example, in today's gospel, Jesus says, "Whoever loves father or mother more than me is not worthy of me." The intention here is not to hate your father and mother. That's against the fourth commandment. Rather, the point here is to love our Lord above all else, including your father and mother. So separation from your father and mother might be a foreseen effect of following the gospel and following our Lord. In our ectopic pregnancy case, if we could save the baby, we would. And maybe at some point in the future, technology will allow us to be able to do that. But for now, this is a foreseen but undesired effect that is merely tolerated with a heavy heart. Finally, number 4, in the principle of double effect, the good effect must be at least equivalent in importance to the evil effect. So this is judging the importance of the good and evil effects. This is called proportionality. The good effect must be equal to the evil, if not greater. And in our ectopic pregnancy example, it's one life lost and one life saved. So sort of equal terms there. You wouldn't, for example, put a thief on death row for stealing a 12-pack of Mountain Dew, right? That's not proportional. This is there's what I call a hierarchy of rights when it comes to proportionality, and you kind of can judge it based off of it fitting into these 3 categories, which I've taken from the Declaration of Independence. The hierarchy of rights helps us to resolve some cases of proportionality more easily. So as I talked way back when I was discussing the natural law, these are the 3 inalienable rights of life, liberty, and property. And these are in order of purpose, or in order of importance. The life is needed to have liberty, and liberty is needed to have property. So when it comes to proportionality, life trumps liberty, and so on and so forth. For example, the right to life trumps a mother's liberty to choose abortion. Liberty trumps property. The right of a slave's freedom trumps a slaveholder's claim to private property. So those are the 4 elements of double effect. Number 1, the action chosen must be morally good or at least morally neutral. Number 2, the good effect must not come about because of the evil effect, but must come directly from the action itself. Number 3, the good must be willed and the evil effect merely tolerated. And number 4, the good effect must be at least equivalent in importance to the evil effect. A lot of decisions that we make in our lives are cases of the principle of double effect, whether we realize it or not. Waging war, which I'm going to talk about in the upcoming weeks, waging war is a situation of double effect. We attack to attain justice and peace at the unwanted cost of human lives. Taking medications with side effects is a situation of double effect. You don't want the side effects, but you might be willing to risk them for a good outcome. Giving pain medication in an unsafe dosage to a terminal patient can be a scenario of double effect. Many comfort care patients are on enough fentanyl to kill a horse, but that's just to manage their pain. Can a pregnant woman who has aggressive cancer undergo treatment that will likely result in the death of her unborn child? Yes, as long as the point isn't to kill the child. St. Gianna Molla had that option presented to her. She could either have an operation to save her life, or she could delay treatment until after her child is born. And she chose to have the baby first, and it cost her her life. But she also could have chosen to undergo the treatment at the unwanted risk of her baby's life. It was up to her. It was her choice. She didn't have to risk her life, but she did. She could have easily and morally chosen the treatment, but she didn't. Either way, it would have been a morally acceptable choice with some undesired consequences. So that is the end of our series on evaluating moral choices. Next, we will begin the final topic in this 3.5 years long thing, and that is the topic of Catholic social teaching.